Howdy, I'm Dr. Adam Wright, a hip and knee replacement orthopedic surgeon in Plano, Texas. We did a video a while back on hip replacements and some of the common reasons to do that, and I talked about one of my patients, and we've had lots of questions about it, and I'm really thankful for you guys getting involved in the chat. I'm happy to answer some of those today. We've had a lot, and so please keep them coming, and I'll tell you the answers to some of the questions you've asked. One of the common questions we've had is about losing weight prior to surgery. There's a lot of people that have terrible hips and they can't get around, but they also are overweight. And it's hard to work out if your hips or your knees or whatever arthritic body part you have is hurting. But it's also very critical to lose weight because when we tell people that, it's not because we're trying to be mean or fat shaming or anything like that. It's because we want the best outcome for the patient. And unfortunately, if you carry extra weight, what can happen is the hip replacement can wear out faster and then you're in the same position you're in before. Or it can get infected, which is a problem that none of us, including the patient, want to deal with because it's really hard on your body. The best way to lose weight, number one, is diet and a supervised medical weight loss. There are lots of questions about gastric sleeves or bypass, and as an orthopedic community, we think that that's helpful, but sometimes it can cause its own set of issues, nutritional deficiencies and things like that. Typically, we recommend low impact exercise, things like swimming or stationary biking, where it's easy on the hips. Even an arthritic hip, it's good for it to move and it usually feels better. But there are a lot of tools now available to medical doctors to help people lose weight. Commonly, things that you've heard about in the news, medicines like Ozempic. I've had patients lose lots of weight on that to the point that they're now able to get surgery. So this is a complex problem that requires more than one doctor and the team of the doctors and the patient really getting together and working hard to get you better. We've had other patients about timing of cardiac surgeries and hip surgeries or knee surgeries or anything else. Both of these are major surgeries. Operating on your heart's a big deal, and we want to make sure you're completely over that before we move on to the next thing, if you will. That's a conversation that your surgeon and your cardiologist have to say, hey, when is the best timing? When do you feel like the heart has recovered and is in a good place to be able to tolerate the stress, not only of surgery for a joint replacement, but recovery and the therapy afterwards? Most of the time, the general recommendation is 6 months to a year. And part of that is because when you get cardiac surgeries, you're usually on some sort of blood thinners that we don't want active during the time of our hip or knee replacements. So I think that's an individualized treatment plan, but most of the time cardiologists and heart surgeons will say 6 months to a year, and then we can maybe pare down on some of these anticoagulation medicines to make the surgery a little safer. We've had other questions about specific things that show up in recovery for hip replacement. Specifically questions about soreness and numbness around the thigh. Every approach to the hip has its own advantages and disadvantages. Most commonly in the United States and really throughout the world, people do what's called a posterior approach, and that means that the incision is on the side and you go through the back. Muscles are cut off the hip, but it's really easy for the surgeon to see. Complications, some of them are lower. However, one complication, which is dislocation, is higher, and that's one we like to avoid. There's also maybe some muscle weakness or some soreness that can occur. Now, typically, people are doing surgeries from the front, or what's called the anterior approach, and there are variations in between these two as well. But one of the disadvantages to the anterior approach is that there's some muscle soreness. There's typically not any muscle cut off of the hip, but we pull really hard to be able to see what we're trying to see to replace that hip at the time. So muscle soreness can last for a while. Specifically soreness with hip flexion, so picking your hip up, that's one of the muscles we pull on a lot to get out of the way. And so that's one of the last pains that go away, and it can take a couple months. But it's usually getting better throughout the time of surgery. One of the other things that can happen is numbness around the thigh, and that is typical. There's a skin nerve that goes right near where our incision is, and we typically don't necessarily cut it, but again, we pull on it. And that traction injury to the nerve can last for a long time. Depending on how well nerves recover, it could be forever, but usually over the course of a year, that nerve will recover and start to feel better. One of the signs of a nerve recovering actually is burning or shooting pains. And so if you're beginning to feel that where you didn't feel it before, it actually can be a good thing. Itching, burning, shooting, it means the nerve is starting to put itself back together.